afternoon and thanks for joining us. I'm Judy Simpson. Today on the program we feature a new segment in our ongoing partnership with the Vermont Cancer Center of the University of Vermont and Fletcher Allen Healthcare. On Friday, October 10th, the center presents its 17th annual Breast Cancer Conference at the Sheridan Conference Center in South Burlington. One of the conference speakers will focus on the interplay between human health and the environment. Specifically, Dr. Christine Badovec will address the topic of nature contact and how it benefits our health. In addition to being a member of the Cancer Center, Dr. Badovec holds joint appointments as a research professor in UVM's Rubenstein School of Environment and Natural Resources and in the university's College of Medicine. Well, welcome. Thanks so much for being with us. I think this is really fascinating.
Excellent. Glad to be here.
In preparing for the program, I noted your interesting background that includes organic dairying, as well as wolves and flying squirrels. So tell our viewers a little bit about that.
Okay, sure. So I grew up in just outside of Cooperstown, New York, so not too far from here, on a pretty small organic dairy farm. My family had about 60 total cows. We milked about 30 cows at any given time. And so growing up in that sort of setting, I was outside quite a lot and, working with animals, really starting to gain an appreciation for the natural world just through those early experiences. And I went on to want to study the environment, and I started off really interested in natural resources and conservation. And so I went off for my undergraduate work and earned a degree in natural resources. And after that experience, I traveled around the country for a year doing a variety of different research projects as an assistant. And I took the bus from the East Coast all the way out to Utah. And I was in Cedar City, Utah for 3 months, and that's where I was studying prairie dogs. We were looking at the interactions between cattle ranching and prairie dogs, which are an endemic species. And then from there, I traveled again by bus up to Washington State, where we were looking at flying squirrels, trying to understand how different forest management processes, and whether clear cutting or leaving patches of forest, how that impacted the flying squirrel population as a prey population for larger predator species, including some owls. And then from there, I traveled to Minnesota. And in Minnesota, I first studied this really, probably one of the most exciting experiences that I've had in conservation biology, where we were studying the interactions between deer and gray wolves, and I got to fly around in a fixed-wing aircraft doing radio telemetry of the wolf populations and the deer populations. We were following them to see the interactions and how this changed depending on snow depth. And then started studying some prairie songbirds the summer after that, and decided to stick around in Minnesota and got a master's degree in conservation biology for a couple of years up there. And that process actually returned back to my agricultural roots, and I studied weeds. And I was looking at weeds in agricultural fields, whether or not we could use weeds as actually a form of biological diversity that would be beneficial, where there's certain weeds that could be beneficial in crop settings. And after that, I moved on to other things. I was an environmental planner for a few years down in Washington, D.C., working on restoration of the Anacostia River, and then got the inspiration to go back for my doctoral work and traveled to Madison, Wisconsin for that, and started looking at this question of interactions between different medical practices and the environment.
Well, so now your research focuses on the interplay between human health and the environment. What does that mean?
Right, so there are a few different ways that I look at it, and one is the way that humans make decisions and choose how our health care, the practices that we use in healthcare have an environmental impact just through the resources that we use in terms of, you can think about the plastics that are used in medical care, and those have a life cycle. They've come from somewhere, they're derived from oil. Where do they go when we dispose of them? They're, a waste product in some way. What is the cumulative environmental impact of that? And then on the other side of things is this idea that, the natural environment also provides benefits to us in terms of improving our health. And so that's the area that I'll be focusing on at the Breast Cancer Conference.
Let's talk a little bit about how the environment impacts human health. It's a concept that includes nature contact. What does that mean?
Sure. So nature contact, it is very much what it says it is. It's the idea of having exposure to the natural world. So opportunities for being either actually outdoors, where we've seen some of the research suggests that actually immersing yourself in the outdoors, going for a walk in a park, or sitting outside under a tree, those can have some really good benefits for human health. And
Well, I think that's very intuitive. I mean, I know people love to just be outside, go for a walk. They feel better. It clears your mind, makes you feel better to hear the wind, to hear the birds, and so forth. So that doesn't really kind of surprise me. But I think it's interesting that now you're taking it into sort of a more clinical setting and trying to prove some theories.
Right, yes. So there's been some research done, and lots of fascinating research has been done in this area. And we've had some research for the past 30 years, depending on different settings and different populations that have been looked at. And some of the first research was done on people who had just gone through different surgeries, and whether or not they had a view from their window that looked out on a tree versus a brick wall. And people who had a view of their tree instead of the brick wall, they were able to be discharged from the hospital approximately a day earlier than people who saw the brick wall. They had a requirement for less pain medication, and they had more positive interactions with the nursing staff. So, and that was the only difference that was seen in the differences between the treatments.
Was the view out the window.
Was the view out the window. And so from there, the research has gone into lots of different areas. Most recently, some of the places that people have been looking at are having people walk down a city street versus walking through a park, and measuring different stress markers. So, surveying people to ask them, what is your perceived stress? How much stress do you feel right now? And then also taking samples of cortisol from either blood or saliva and comparing and seeing, how do our stress biomarkers change when we're in an outdoor natural environment versus when we are in a more stressful environment like a city street.
And so, you were talking about that your work is kind of very preliminary, but there are all kinds of these sort of anecdotal, if you will, or even proven facts that being in nature is less stressful, which can go anywhere you want when it comes to health benefits.
Right, yes. And there are two particular areas where we know, well, the first is really this idea of stress reduction from those things that I was saying before. And the second area is attention restoration. And this is this idea that as, being busy people, everyone has so many different things that we're focusing on. People are multitasking increasingly, and our brains get taxed by that, right? We're kind of overwhelmed by the information that we're being overloaded with. And so there's been some interesting, research, particularly by Stephen and Rachel Kaplan, who are at the University of Michigan, and they've created this theory of attention restoration, this idea that being out in a natural environment, or even just having contact with natural elements, like having a plant that sits in your office, things like that, that can actually improve your attention restoration by allowing you an opportunity to kind of sit back and be in an environment that is promoting of health, and taking that opportunity to let your brain kind of reshuffle, kind of, yeah, so that you can come back to the task at hand and be more focused when you're returning to that task.
Which is why a lot of people will take a walk in the middle of the day. It helps them kind of refocus on that, which is why I don't understand why people have headsets on.
Right, yes, and this is actually something, so Richard Louv, people might be familiar with that. He wrote the book Last Child in the Woods, and this was something came out a few years ago. And it really popularized this idea of nature deficit disorder, and the fact that children in particular, they do have so much information coming at them from different places. And there were some great quotes in there from interviews that Richard Louv had performed, and talking to parents of children. And the parents were like, we're in these beautiful settings. We go for skiing, or we're out in a park, and our kids have headphones on. And we're like, why is that? Like, can we somehow reconnect to nature? And what would be the benefit of doing that?
Right. So how does the concept of nature contact apply to breast cancer survivors?
Sure. So I think most basically the idea is that breast cancer survivors, the whole process from the time of diagnosis through treatment and recovery, it can be very stressful. And just thinking of all the different things that you're potentially worrying about and thinking about, whether or not you're able to sleep at night, just thinking about, what's going to happen to me, what's going to happen to my family. It's a very stressful experience. And so potentially nature contact can be one of those tools that we can use to help people through that process and have a better quality of life, have lower amounts of stress, being able to focus more on the task at hand.
And so what are some of the things that people should do or could do to gain the benefits of nature contact during and after treatment?
Sure. So there's a whole range of things you can do. From my understanding of the literature, right now, the best things that you can do are to actually get outside, go for a walk in the park, sit on a bench. If you're not able to easily move around, if you have limited accessibility, just being outside can have an improvement on your stress. And really, stopping and, the old saying of stopping to smell the roses, really taking time for yourself and thinking about taking care of yourself and how that will allow you to take care of all those other things that you have going on in your life. And particularly for breast cancer patients, just that idea of trying to reduce the amount of stress that you have can help improve your recovery as well.
So being outside can kind of be like a timeout for everything else that you've been going through.
Sure, absolutely, absolutely. And then there are a whole other range of things that people can do. Having pets or contact with animals is definitely an area that we know is beneficial to people. Going camping, just having gardening, horticultural therapy is a large area of research. Just having your hands in the dirt or working with plants, having a plant sitting in your kitchen, having the more plants you have, the better. There's actually some research on that. The more plants you have, the better stress reduction you can have. And there's just a whole array of different opportunities that people have to increase their contact with nature.
I think it's interesting that it doesn't have to be, hiking the long trail. It can just be as simple as having a houseplant.
It can be as simple as having a houseplant. There's also been some interesting research on viewing natural programs on television or listening to natural sounds. There is this great study that was actually with patients in a hospital setting, and they typically you're sitting there during a procedure, you're waiting for the procedure to begin, and you might have one of those curtains that's drawn around your bed, and you're just sitting there and quiet and waiting and listening to all the noises out there.
You've already read the magazine.
Right, you've already read the magazine. What are you going to do now? So there's one study they put on that curtain, they had a picture of a natural landscape, and they piped in natural sounds like bird sounds or water sounds, and they found that actually decreased not only the stress level but the perceived pain that people had during the procedure.
That's fascinating. We've got about a minute left. Maybe you could sum up what you're going to be discussing at the Breast Cancer Conference.
Sure. So I'll be talking a lot more in depth about some of the things that we've covered today, just what are some opportunities that we have for trying to increase nature contact, and also extending that to the caregivers and the staff as well, because if we allow staff to have time to take a walk at their lunch break or something where they can get out into the natural world, go to the greenhouse, things like that, that can improve their attention restoration. So when they come back to help you and work with you as a patient, they can be better focused and more capable staff members.
Well, a final reminder before we go that the 17th Annual Breast Cancer Conference is Friday, October 10th at the Sheridan Conference Center in South Burlington. The conference gets underway at 8. It is free to anybody who wants to attend. To register in advance, you can go online to vermontcancer.org and click on the pink banner. If you prefer, you can register by phone by calling 802-656-2292. And last but not least, if you have any questions, you can email Charles Brooks. His email address is listed on your screen along with the website and the phone number. Thanks so much for coming in today. I could talk about this for hours.
Thank you very much for having me. I appreciate the time.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.